Hi, my name is Dr. Anthony Perry. I'm the Director of New Patient Intake at Cancer Treatment Centers of America here in Philadelphia. Today we're going to talk about Cancer 101, and we're going to specifically address breast, lung, and colon cancer. Our objectives today are to review the warning signs and symptoms, risk factors, and screening recommendations for breast cancer, lung cancer, and colon cancer. What we see is that there are several cancers that are at much higher incidence than others. So specifically for women, breast cancer, lung cancer, and colon cancer are common, and for men, it's prostate, lung, and colon cancer. We're first going to talk a little bit about breast cancer. What are the signs and symptoms of breast cancer? It may be a lump that a woman finds by herself. It could be an area of dimpling in the skin, discharge from the nipple, and sometimes it can just be the appearance of a rash. There should also be some attention to see if there are any changes otherwise in the skin or in the armpit. There are some risk factors that are changeable or modifiable. So for instance, physical activity may reduce your risk of breast cancer. A woman who has had prior radiation to the chest is at higher risk. A woman that has had no children is at higher risk for developing breast cancer. In the old days, oral contraceptive such as birth control pills would raise risk. The newer ones have less of a risk associated with it. And there are other things such as breastfeeding, prior hormone treatment, alcohol, and obesity that also play a role. We know that for every 5 points above a BMI of 25, your risk of breast cancer actually increases by about 12%. So it's very important to keep your weight under control. There are things that cannot be changed that are not modifiable. So for instance, being a woman cannot be changed. Also, the age that you started your menstruation is also a factor that determines your risk. So women who have had their menstrual periods earlier on in life are at higher risk of developing breast cancer in their life. Also, women who go through menopause later are at higher risk. Other things like breast density are associated with increased breast cancer risk. So for instance, a woman who has very dense breasts is at a little higher risk than a person who does not have dense breasts. We also know that factors such as family history, age, and genetics, you cannot modify or change, but definitely affect risk of breast cancer. There are some factors that we're just not sure how they play a role in the development of breast cancer. So for instance, smoking, working at night primarily may be a risk factor, having had an abortion. There are also some concerns about the type of underwire bras or antiperspirants that may also increase risk. There are certain breast implants that can raise risk of cancer, specifically lymphoma. And there are other chemicals that can play a role as well. So how do we determine breast cancer risk? There's actually a tool called the Gail model. The Gail model is a tool in which we kind of plug in some factors that help determine what a person's risk over their lifetime and also in the short term over a 5-year period will be. And the important part of it is that if your risk of developing breast cancer is over 1.7% over 5 years, there are some things that you might want to consider, including preventative medication. We also know that women who are at a lifetime risk greater than 20% may choose to do breast cancer screening above and beyond just a simple mammography. Sometimes breast MRI alternating with mammography may be an option for breast cancer screening as well. So speaking a little bit about breast density, today, many states actually require reporting of how dense the breasts are. Specifically, as we get older, women's breasts typically get more fatty, and it actually makes it a little bit easier to see if there is something hiding in there like cancer. Women who are extremely young have denser breasts, and that makes the sensitivity of mammography in detecting cancers less reliable. The old way to screen would be what's called film mammography. Today, more and more places are using digital mammography where they're using computers to determine a better way to reconstitute breast tissue and take a look for tumors. There's also a 3D imaging that's now being used called digital breast tomosynthesis, otherwise known as DBT. Not all insurances pay for it, but some women elect to pay that extra out-of-pocket cost because it is somewhat more sensitive. There's been some evaluation of what to do in women who have higher density breasts. So for instance, there's several studies that look at things like breast ultrasound, digital breast tomosynthesis or breast MRI. There was a study published called the ASTOUND study within the last several years that compared some of these modalities. And what it showed was that in women who have extremely dense breasts, they may have a discussion with their physician about the use of things like digital breast tomosynthesis or ultrasound as a screening method. Although typically right now, most of the screening boards have recommended plain digital mammography. So if you look at breast cancer screening and when to start mammograms, the American Cancer Society, the United States Preventative Services Task Force, and other screening boards have specific recommendations. So for instance, all of them recommend starting at least at age 45 breast cancer screening with mammography. Many of them, however, have also leaned towards going younger, starting at age 40, and having a discussion with your doctor about the benefits and harms of screening. The American Cancer Society recommends starting at 45, having a yearly mammogram until age 55, and then having a mammogram every 2 years thereafterwards. In regards to breast self-examination, all of the screening boards recommend against self-breast examinations. So in the old days, when we would ask women, typically after their menstrual period was over, in the shower to do breast self-examination, that has gone by the wayside primarily because what has been found is that it does not change the risk of dying from breast cancer. And that's been exhibited in multiple studies. That being said, what they all do recommend is something called breast self-awareness. So what's the difference? Breast self-awareness means not necessarily in a regimented way like we used to recommend doing a self-breast exam, but what they want you to be aware of is any change in the nipple, discharge, if you feel a lump or pain, and that's what self-breast awareness is. And if you find that anything has changed at all, what they recommend is to seek your physician for further evaluation. There are some recommendations about clinical breast exam. That means going to your doctor and getting a breast examination. The American College of Obstetrics and Gynecology actually recommends that that be done because there are some studies that have shown that it reduces breast cancer deaths, although some of the other boards have not necessarily gotten on board with that recommendation. So we're next going to talk about lung cancer, which is the #1 cause of death in men and women in the United States. So what are the signs of lung cancer? It can be a cough, shortness of breath, coughing up blood, losing weight. These are all potentially signs and symptoms of lung cancer. What things are modifiable or what things can you change? Obviously, cigarette smoking is #1. Cigarette smoking is responsible for 85% of all lung cancers. But there are other things, however, that contribute. So for instance, radon exposure can raise your risk of lung cancer. So when you're buying a new home in many states, they actually require you to test the soil to see if radon is being emitted because they've shown that long-term exposure can raise risk of lung cancer. There are also some supplements to avoid. So for instance, several years back, they did a study thinking that an antioxidant vitamin called beta-carotene in smokers may reduce the risk of lung cancer. However, it showed the opposite. And actually, there was an increased risk of about 18 to 28% in smokers who took beta-carotene between 5 and 8 years. So the take-home message is don't take beta-carotene, especially if you're a smoker. There are other exposures to consider. The most commonly seen one in the past was asbestos. Thankfully, the use of asbestos in homes for insulation and the use in brake pads has gone away, but people years ago were exposed and they still are at higher risk for lung cancer. Additionally, there are diesel fumes that raise risk as well. Certainly, secondhand smoke is something that also needs to be avoided. There are things that you cannot modify or change. So you cannot change genetics. Certain infections like HIV or tuberculosis, once you've had them, it's hard to necessarily modify that. There are certain lung diseases such as chronic obstructive pulmonary disease or idiopathic pulmonary fibrosis, which causes scarring within the lungs. Those are things that make a person at higher risk for lung cancer. And also there are a number of other things such as your age, what race you are, that may raise your risk of lung cancer as well. And so what we know today is that in high-risk individuals for lung cancer, screening should be done. So when we take a look at lung cancer screening, really when they compared chest x-ray versus low-dose CAT scan, what was found was that chest x-rays were not a reasonable way to screen for lung cancer. And really, when you take a look at survival of lung cancer, it really depends on the stage at which you're diagnosed. So it's so important to detect it at an early stage. There was a study that was published. It was the National Lung Cancer Screening Trial that showed about a 20% reduction in lung cancer deaths in those who are eligible for lung cancer screening. And so if you take a look at the different screening boards, like the United States Preventive Services Task Force and Medicare, and a number of other regulatory bodies that make recommendations about screening, what they say is that typically a person between the age of 55 and 79 who has smoked 1 pack a day for 30 years and has quit within the last 15 years or is still smoking, they're eligible for lung cancer screening and should have a low-dose CAT scan on a yearly basis. There are other boards that look at other factors. So for instance, the National Comprehensive Cancer Center looks at a 20-pack year history along with other risk factors as kind of criteria of who meets the ability to get lung cancer screening. So it's important to talk to your doctor about that. The third cancer that we're going to talk about is colon cancer. 1 out of 20 people will get colon cancer. And if you get a colonoscopy and they find a precancerous lesion called a polyp and remove it, it reduces your risk of developing colon cancer by 90%. What are the signs and symptoms of colon cancer? Some people have fatigue, weight loss, weakness, a change in their bowel habits. Their stools can become thinner. They may have bleeding that also is part of the symptoms that they have, or they can have pain when they're having a bowel movement. There are some things that you can modify or change. Obesity, again, is one of the risk factors, so people who are overweight are at higher risk. People who have had radiation to their abdomen or who have a diet low in fruits and vegetables or who don't exercise very much are at higher risk. Alcohol, red meat, and low-fiber diets also play a role. There are some things that you can't change. They're not modifiable. So for instance, your race, your family history, your gender. If you've had a diagnosis of inflammatory bowel disease like Crohn's disease or ulcerative colitis, those are things that put you at risk for colon cancer. But those are things that you can't really change. So there's a few options that a person has for colon cancer screening. So the one that I recommend and that most people at Cancer Treatment Centers of America recommend is colonoscopy. And the reason for that is that it's a test that not only can detect precancerous lesions, but can also remove it and treat that precancerous lesion at the same time. The other acceptable methods are things like fecal immunohistochemical test, otherwise known as FIT testing. It involves sending some of your stool on a card back to the tester, which will test it to see if potentially you're at risk for colon cancer. There's also a newer test that is a DNA-based test. And similarly, after discussion with your doctor, what happens is if you and your doctor complete a form, that form goes to the company, which will send you a kit through the mail. You'll return that, which is basically they want part of your stool back, and they'll test it for DNA that will indicate potentially the risk for colon cancer as well. If you take a look at colonoscopy, again, colonoscopy in an average risk person would be typically recommended every 10 years unless they found polyps. There are other methods, such as flexible sigmoidoscopy. That means instead of going throughout the whole colon, they really look at the left side of the colon. And the reason why we generally don't recommend that as often is because what we're finding is that many cancers are becoming right-sided, which wouldn't be detectable with just a flexible sigmoidoscopy. So again, many organizations recommend colon cancer screening. Typically, there are things that put people at risk specifically through genetics. So people who have something called Lynch syndrome, which is a syndrome that puts people at risk for colon cancer and endometrial cancer. That is a condition which increases risk of colon cancer. There's also something called FAP, in which people are born with a lot of colon polyps and develop a ton of colon polyps in their lifetime. And so if you take a look at colon cancer recommendations, pretty much everybody recommends that you should start colon cancer screening for an average risk person between the age of 45 and 50. So for instance, the American College of Gastroenterology recommends starting at age 45. And if you have a normal colonoscopy, then repeating it in 10 years. The United States Services Preventative Task Force recommends starting at age 50 and then again every 10 years. depending on the findings on the original colonoscopy. There's also discussion regarding race. So many panels, including the American College of Gastroenterology, recommend starting in African American patients at age 45, and more recently, within the last year or two, they've expanded that to all races. The other options, again, are to use a stool-based test. Part of that's called a fecal immunohistochemical test or a DNA test, and those are reliable options for people who cannot get a colonoscopy done. The important thing is to get screened, and that's number one. So I recommend breast cancer screening for women be done typically in a couple of different ways. So number one, I recommend breast self-awareness, which again means being aware of any changes within your breast and alerting your doctor if you have any concerns that something has changed, whether it be dimpling of the skin, whether it be any lump that you find, or pain in the breast, or nipple discharge. Additionally, breast cancer screening with mammography should start for all women at the very least at age 45. The next cancer that I recommend screening for in appropriate people is lung cancer screening. It's very clear that there's a reduction in the risk of dying from lung cancer if you do appropriate screening. And in smokers who have at least one pack a day of smoking for 30 years, who have quit within the last 15 years or are still smoking, they should absolutely get lung cancer screening with a low-dose CAT scan, and that you can obtain through your doctor as well. The third type of cancer is colon cancer screening. And so colon cancer screening should start at the very minimum at age 50, although today many people are recommending starting at age 45, which is what I recommend. Typically, if you have any signs or symptoms, it should be addressed earlier than that, as we're finding that many people today are being diagnosed with colon cancer at an earlier age. And the recommended screening test is colonoscopy. Although if a person has reasons that they cannot do a colonoscopy, there are other acceptable ways to screen for colon cancer, such as the DNA test and what's called FIT testing, which is also a stool test. Thank you for joining the discussion today. I hope you learned a lot about the more common types of cancer, what to look for as far as signs and symptoms, and then how to prevent them through screening. For more information, please visit cancercenter.com.